So today I'm going to explain to you a bit about what surveillance actually is, why we should really think seriously about using Twitter to accomplish this task, and then we'll be presenting to you 3 test cases of using NLP-based content analysis to accomplish surveillance on Twitter. So I will be presenting to you a case of using Twitter for asthma surveillance. Bethany will present using Twitter for generalized syndromic surveillance. And then Mark will be finishing things off with a presentation of using Twitter for tobacco surveillance. So, what exactly is surveillance? Well, you can think of it basically as being reliant upon a sensor model. So if you think of the internet, there's a large amount of data out there, and you can think of users on the internet as each comprising a sensor, a node on the network, that's able to report on what's going on in their general area without you having to actually be there to find out what they're doing. And you can get updates to this information in real time, so it's both geographically and temporally distributed. And people have used surveillance in the past to look at things like tracking the outbreak of H1N1. The US Geological Survey has a system called Did You Feel It that tracks earthquakes faster than they can actually register it using their own equipment. And then it's also been used to collect generalized syndromic health data. So we're proposing that we should use Twitter for this, mostly because it's a microblogging site, which means that users are able to update as quickly as they like with 140 characters, basically anything that's going on in their vicinity, whatever insights they might have, relevant or non. So they're very short texts, so you don't have to do things like track long spans of co-reference or cross-sentential dependencies like you might have to with other kinds of data. But of course, because it's such a small format, it presents its own challenges. It's actually a lot more vague. It's harder to figure out necessarily what's going on because there's just sort of a lack of context. It's also a social network, which means that we can use Twitter to track the impact of individual users on the rest of their social network. And interestingly, for medical applications, the demographics of Twitter disproportionately favor African American and Hispanic users, as well as younger and urban populations, which means that by using Twitter, we can actually have access to underserved and hard-to-reach groups. Other advantages of Twitter over other data sources include the fact that, well, it's free to access Twitter data. It's also a lot less subject to legal restrictions because people are putting this information out online themselves, so it's public. It's also real-time, and you're getting the input directly from the patient rather than having it filtered through the eyes of a clinician first. And it's also localizable and monitorable over time. Of course, there are disadvantages to using Twitter. A lot of the current approaches to using Twitter for surveillance are actually just keyword-based, which means that you might think that you're detecting an outbreak of fever because all of a sudden there are all of these results that say, oh, fever, 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 fever. But actually it's just Justin Bieber. So our goal is basically boosting the signal out of all of this noise. So what we're doing is a series of content analyses where a content analysis is basically you go out and you collect tweets, and you can do this either by keyword search or through random sampling. And then you annotate the tweets that you get for various categorical features. And then you train a classifier, and you use the classifier to try and predict incoming tweets. So with that bit of background out of the way, I'm going to start into one of our first test cases. So I will be presenting to you a content analysis of asthma-related tweets. And I'd just like to acknowledge the people that have been helping me out over the course of the summer. So that's the folks here at DBMI, so Wendy Chapman and Mike Conway, but also the folks at West Wireless Health Institute. So Dr. Casal, Dr. Pettigrew, and Dr. Crowley, who have been helping me from there. The West Wireless Institute, for those of you who don't know, is a nonprofit organization that is dedicated to lowering the costs of healthcare, basically through the use of technology. So what we've been doing is looking at asthma-related tweets. We've collected a few thousand of them at this point, using keyword searches keyed on search terms like asthma, common misspellings of that word, as well as medical technologies related to that, so things like inhaler, the brand name albuterol. And importantly, we've been focused only on those Twitter users who report their language as being English. And then we've hand classified a randomly sampled subset of the tweets, and we've been trying to predict who exactly is experiencing asthma and what they're saying about it. So here in this graph, it's quite large. Don't worry too much about it. Basically, all it's trying to explain to you is that we're trying to predict things about who's experiencing asthma, what the content of their tweet is, and the temporality of what they're tweeting about. So whether or not it relates to the future, because in general, what people tweet about has actually previously happened to them. But you can see that, so roughly 1 in 5 of the tweets that we've collected actually refer to the tweeter as experiencing symptoms. And then fewer than that refer to their experiences with their medication, and fewer than that still are complaints. But then there's this huge cluster here that comprises over 40% of the tweets that we've collected that are either spam, jokes, or not in English. And so if you're a clinician doing research, you'd obviously want to sort that out before you actually go in and try to do anything with the data, because it's wasting your time, essentially, to look at things that are like that. So here we can see that there's actually fairly good separation between categories like spam and categories where the user is actually experiencing symptoms. So here we can see that, the word asthma comes up very frequently in both categories, but that's to be expected because that was one of the keywords that we searched for. But you can see that in the spam category, we have words like buy and albuterol and treatment, generic medicine, and then some sketchy little Twitter links here. Whereas in the self category, we have words like attack and inhaler and just and now and got, little words that actual humans would use, but that bots wouldn't need to if all they're trying to do is sell you generic medicine. So in order to extract that and be able to predict on the fly, we need to extract those predictive features. So what we've done is to use the text miner package in R to convert the corpus of tweets into document term matrices, where each tweet is basically transformed into a multidimensional vector based on the words that it contains, as well as all of the words in the tweets. And you have a little example of that right here. And then we eliminated terms that occurred in fewer than 0.5% of the tweets, because they're just not going to help us very much to classify, and they slow down our algorithms. And then we use chi-squared to extract overrepresented terms, as well as significant metadata by class using the fselector package. And then we use the features that we've extracted to train machine learning classifiers. We trained a variety of them, including naive Bayes, k-nearest neighbor, decision tree, and support vector machines. And as often happens, SVM turned out to be the best of these algorithms. And we can see that we've actually had some successes. So in the self category, we have successfully eliminated 80% of the tweets, which are just noise. And we're actually getting about half of those where the user is actually talking about themselves. In the medication category, we're also doing fairly well at pulling out tweets where users are talking about their experiences with their medication. And then we're also achieving very good coverage of non-English tweets. So it should be fairly clear that this would actually help a clinician who was doing research to narrow down on tweets that are actually going to help them. On the other hand, we're doing a lot worse with sort of sparser categories like family, friend, and other as experiencers of asthma. And that's just basically because there's not very much signal out there in the data. So the terminology that people use to refer to their friends, for instance, is very varied, and so nothing is particularly predictive in this case. But here are some examples of the successes that we're having at pulling out tweets referring to the user experiencing symptoms. So these are all from the test set and ones that the algorithm has determined actually are referring to the user. So a pretty typical one would be something like bad day, forgot inhaler, and hay fever tablet. Another one would be we're home, weather rotten, and I got wheezy walking with my asthma, and my legs started hurting. Mom got me a coloring book. And then my favorite one, meanwhile, I thought I'd left my Ventolin inhaler at work and considered bailing on the gym to go home and paint Warhammer miniatures, which anyone who's ever had a nerdy younger sibling understands. So, just sort of in conclusion and to prefigure future work, I'd just like to point out that these methods are general. We looked at asthma because it's a disease that affects uninsured and at-risk populations more often than others, and so reducing emergency room visits in that population would be worthwhile to lower the cost of healthcare, but you could conceivably use this to analyze any disease that people were talking about on Twitter. And you could use this as a clinician potentially to back up epidemiological research using location information, as well as determining people's sentiment about their medication without having to go through the clinician first, because people say things on Twitter that they might not say to their doctors. And then finally, once the classifier itself is trained, it can be deployed in real time, which means that you can get information as it's coming in. And a future direction for research would be to record periodic feedback on classifications that the model is giving in order to try and help improve accuracy. So with all that being said, I'm going to pass this presentation over to Bethany Keffala, who's going to talk to you about generalized syndromic surveillance. Thank you.
Okay, I'm going to be talking to you about content analysis of syndromic tweets. And I'd like to start off by thanking my mentors, Wendy Chapman and Mike Conway, as well as Sun Duan and Nigel Collier for the use of their annotated corpus of syndromic tweets. Okay, so the project that, sorry, that sounded very loud. The project that I've been doing can be broken down into 3 steps. These include, first, replication of the methodology used by Collier and Duan in their binary annotation of syndromic tweets. The second step, which I'm currently in the middle of, is enriching the annotation scheme for classification of syndromic tweets. And then finally, classifier training using this enriched annotation. The data that I've been using is, again, an annotated corpus of syndromic tweets. There are about 8,000 of them. And these are separated into 6 syndromes, as defined by the Biocaster Public Health Ontology. You can basically think of a syndrome as a class of diseases, and these are defined by different constellations of symptoms. The syndromes that we're looking at are respiratory, constitutional, gastrointestinal, neurological, rash, and hemorrhagic. Okay, the tweets were collected using keyword search, and each tweet was classified into one syndromic category, where again a syndrome equals a collection of symptoms, and these are related to the keywords. So for an example, respiratory keywords might include things like asthma, cough, breathing trouble, runny nose, sore throat, etc. And tweets that you might get back include things like the sore throat and runny nose I've had for the past few hours doesn't mean anything at all. So the tweets in each syndromic set are categorized in a binary fashion. Either the tweet belongs in the set or it doesn't. It belongs in the set if it's the case that someone is experiencing symptoms and all of their tweets are irrelevant. Again, my first step in this project was to replicate this methodology. You can see the kappa values in the middle column of this table. They're generally good with the exception of constitutional syndrome. And this isn't entirely unexpected since the definition of the syndrome is somewhat general. And keywords include things like being tired or having sore muscles. So these can return some really ambiguous tweets. Also included here are the ratios of true positive tweets to the total number of tweets per set. And you can see again that there's a range of noise. So there's kind of the most noise for the set of hemorrhagic tweets and the least for constitutional. So as I hinted in the previous slide, when you're using keyword search for a collection of your data, you can get very noisy data in return. So you do get true positives. So for gastrointestinal syndrome, things like, I have a stomach ache, it hurts. But you also get a lot of stuff back like, due to the ending makes me want to throw up, where clearly the user is speaking figuratively. Okay, so here's just a visualization of the frequencies of different words in false positive tweets and true positive tweets from the respiratory section of the corpus. As you can see, cough is very frequent in both. The false positive tweets also happen to be a hotbed of Bieber fever. But what we want to do is get some separation between these two categories. So what we should do is look at what's happening instead in the rest of the tweet. So just even ignoring the word cough, we start to see some separation. So in false positive tweets, we're getting really frequent words like syrup or LOL, like RT, which stands for retweet. But in the true positive tweets, we're getting things like sore throat, fever, things like better or hate, etc. So the main goal of the project has been to enrich the annotation scheme and thereby collect more fine-grained information, kind of along the same lines as Chu and Eisenbach, who looked at tweets related to the H1N1 outbreak. And in collecting more fine-grained information, we can develop a better understanding of the data and also prepare for classifier training using more linguistic cues. So kinds of information that might be interesting even before looking at the data include things like who's experiencing the symptoms, when they're experiencing symptoms, and tweeter attitudes or sentiments towards different symptoms or towards different classes of diseases. But the scheme will depend somewhat on the kinds of information that are actually present in the data. Okay, so this is a summary of content categories and subcategory qualifiers that I've been using to annotate this set of tweets. There's a lot going on here, but I'll walk you through the important parts. So We have three kind of themes of content categories, the first of which is core information. And this is marking things like who's experiencing symptoms, when they're experiencing symptoms, and how they're feeling about those symptoms. We've also got content categories related to language use, so marking things like whether the tweet's in English or not, whether it's using figurative language, humor, or linguistic irrealis. And then we have two kind of other categories here, marking things like substance abuse or transmission of information. Okay, so here's just a small set of false positive tweets from the rash section of the corpus. And we can see that there's some positive sentiment going on, a lot of figurative use, some humor, and some public health advice. And this, you'll see, is already kind of different from what we're finding from the true positive tweets. So here we're finding a lot of people talking about their own symptoms or other people's symptoms. Everyone's talking about symptoms that are happening currently. Sentiment is largely frustration or concern or some other negative emotion. And if humor is used, it tends to be sarcasm. Okay. So I'm currently working on finishing annotation of the corpus using this enriched scheme, and we'll be moving on to train a classifier. The value of this work is in its potential uses, which include things like monitoring public health attitudes towards different kinds of diseases, or detecting outbreaks or the spread of symptoms in real time. So with that, I'll pass it on to Mark.
All right. So in this part, I'm talking about using Twitter for tobacco surveillance. I'd like to thank Wendy Chapman and Mike Conway, as well as Xu Hongzhu, the director of the California Smokers Helpline. So how can we use Twitter to monitor tobacco usage and prevention policies? So I'll go over a content analysis of tobacco-related Twitter posts, then explain some NLP tools that we can use to sift through that data, and go through 3 quick case studies of tobacco surveillance using Twitter. So the first of those is understanding positive sentiment toward tobacco. So we can look at new or adolescent smokers and try to understand what the appeal of smoking is and why people might be starting, or just generally look at public perception of tobacco and level of informativeness of the public. Second, we can use Twitter to evaluate the impact of public health campaigns. So I'll be looking at a CDC campaign that was launched a few months ago. And third, we can use Twitter to monitor new public health challenges, in particular hookah and e-cigarettes. Hookah, for those of you who don't know, is a water pipe used to smoke flavored tobacco. And e-cigarettes are a electronic device that simulate the act of smoking and may or may not be nicotine-based. Both of these products are surging in popularity with especially younger users, but their health effects are at best controversial. Okay, so on to the content analysis. So the way this works is we scrape some data from Twitter, develop a classification scheme, annotate, train a machine to classify for us and predict new data. So scraping Twitter, we collected 6,000 tweets using 5 tobacco-related keywords: tobacco, hookah, cig, smoke, and nicotine, and had 2 annotators annotate portions of the data until we arrived at the agreed upon standard of greater than 0.7 kappa agreement. So this is our classification scheme. Each tweet is classified according to 3 dimensions: genre, theme, and sentiment. So what this means, genre is just what kind of tweet is it? Is it a first-hand experience? Is it a joke? And so on. Theme is what is it about? Is it about social image? Is it about starting tobacco usage? And so on. And sentiment is just positive, negative, or neutral toward tobacco. So a couple examples of actual tweets. An e-cigarette salesman at a mall to Paris and I: do you guys smoke? No. Do you want to start? So that is a first-hand experience that has to do with starting tobacco usage and e-cigarettes. Another example: beer pong hookah round 2 with my goons, what up? I love when my parents aren't home. First-hand experience having to do with hookah, social relationships, pleasure, underage usage, presumably, and other substances, in particular alcohol. And this is, shows a positive sentiment toward tobacco. So that's the classification scheme. Now on to natural language processing tools used to actually implement this. So we use the Rainbow Toolkit, which includes a number of kind of off-the-shelf classifiers, including naive Bayes, k-nearest neighbors, and SVM, to actually classify these categories. Another thing that we need to do, just taking a step back from that, is filtering out non-tobacco related tweets, so we can have this three-way dichotomy between tobacco, marijuana, and unrelated tweets. And this tweet, for example, I can rock polka dots because I'm smoking hot, would be picked up by the keyword smokin' or smoke, but is clearly not tobacco related. So we're at 78% correct classification on this task using k-nearest neighbors, and with a baseline of 49%. So finally, just the three short case studies on the basis of the hand-annotated data. So those are the new public health challenges, understanding positive sentiment toward tobacco, and evaluating public health campaigns. So the new public health challenges. Just looking briefly at the keywords that show up and how they break down by sentiment. So if we look at tobacco, hookah, and cig, we see that cig is relatively evenly distributed between positive and negative sentiment. There is a huge discrepancy, though, with hookah. It is overwhelmingly positive, whereas tobacco is disproportionately negative, which suggests a kind of public disconnect, maybe, since hookah is tobacco, and there may be an opportunity for education there. Second case study, understanding positive sentiment. So since these tweets can be categorized according to multiple categories or multiple values in each category, we can calculate the correlation between each of the different categories. So for example, we can look at the underage category and see what that correlates with. And the top correlation there is social image, followed by experiences of others, obtaining, and starting. So if we're interested in targeting underage usage, we might start by looking at social image. And finally, the third case study is the impact of public health campaigns. So Tips from Former Smokers is a CDC campaign that was launched a few months ago. It ran for 12 weeks, and it was based on graphic portrayals of the health consequences of tobacco usage. So we can look over time at sentiment on Twitter and whether this campaign has any noticeable impact on that. So this is the proportion of tweets in the category cessation or quitting tobacco usage since the beginning of we started collecting data for the corpus, which was in November 2011. So there is a spike on January 1st related to quitting, presumably due to New Year's resolutions. It kind of drops off, sadly, but there's another smaller spike on March 19th, which is the launch date of the CDC campaign. If we look at health, similar patterns, a spike on January 1st, and a much bigger spike on March 19th, which suggests that Twitter, and in particular this methodology, is responsive to the impact of public health campaigns. So those are three case studies of using Twitter for monitoring tobacco usage and prevention policies, new public health challenges, positive sentiment, and public health campaigns. And just to sum up all of our presentations, Twitter is a largely untapped data source so far. It serves some key demographics of underserved and hard to reach populations. It's free, it's accessible, real time, and so on. Natural language processing goes hand in hand with using Twitter for surveillance. Just to improve the signal to noise ratio, there's a lot of false positives, as you've seen, as well as potential automation applications down the line. And it is broadly an area of growing interest. Funding is coming in from NIH, industry, charities, and so on. So Twitter and social media for public health surveillance is a promising new methodology. Thank you.
Thank you so much, Twitter team. Are there any questions about any of the three presentations we just saw? Meanwhile, I'd like to invite the next speaker to please come up. The microphone is on its way.
So these word motifs that you guys have showed where the words are big and little and squinched up, can you explain what that is? Is the size of the word based on the frequency? And then what about the positioning of the word? Some are vertical, some are
Yeah, so the position is meaningless, but the size gives you an indication of the frequency. And those graphs are a common visualization that like NLP people like to use, and the tool is located at wordle.net. So.
Is squish a technical term for one of the?
Oh, yeah.
Okay. Should tweet that, Professor Zambon.